The health risks for chewing tobacco are well documented, in particular the evidence for the risk of oral cancer. Although it's not as widely used as smoked tobacco around the world, there are still a very large number of people who use chewing tobacco. In 2019, almost 274 million people used the product. And this use is particularly high in certain regions around the world, for example, in South Asia in particular, but it's also high in regions such as North Africa, the Middle East, and some island nations. Chewing tobacco prevalence also differs quite a bit in the nature of use from smoked tobacco prevalence. For example, often females use chewing tobacco at a higher rate than males do. In particular, in Cambodia, the age-adjusted rate for females in 2019 was 10 times higher than that of males. And we also see that chewing tobacco prevalence can be quite high in older ages as compared to middle-aged people. The patterns in chewing tobacco prevalence are quite different from smoked tobacco prevalence, and this is part of why countries may need to enact stronger policies that specifically target the use of chewing tobacco use. And we actually see the fact that tobacco intervention policies have not done as much for chewing tobacco use in our study. We compare the prevalence of smoked tobacco use over time to that of chewing tobacco, and there have been fairly large significant declines in smoked tobacco use, but the prevalence of chewing tobacco has been fairly stable over time. So this means that countries really need to be enacting specific policies targeted at chewing tobacco use so that we can curb this super unhealthy habit.